Welcome, bienvenue. My name is Detlev Ganten. Herzlich willkommen to the 9th World Health Summit here in Berlin. Your Royal Highness, Princess Diana Miret from Jordan, Excellencies, Minister for Health Adalberto Campos Fernandes from Portugal, Minister for Health in Germany, Hermann Gröhe, if I may say so, one of the most popular health ministers of this country we've ever had. Dear guests, colleagues and friends, all protocols observed, I greet you all here live in the Rudolf Virchow room of the Cosmos Theatre and our guests via live stream around the world. This year's World Health Summit is about to start. With 2,000 participants, around 100 nations, and more than 40 different sessions, and one major topic: how to improve global health. Science has to take responsibility. This was the fundamental idea when we started the World Health Summit 9 years ago on the occasion of the 300-year anniversary celebration of the Charité. Since then, we can see a lot of fantastic developments. Active global health policy and the support of global health organizations and programs has become a political priority and trademark of German policy, but also around the world. Minister for Health Hermann Gröhe and Chancellor Merkel are the champions in our country, and there's broad consensus across all parties. We hope the same happens and is fact in most of the other countries around the world. Global health was a central topic at the G7 and also at the G20 summits in Germany, supported by the heads of states of these governments. But, ladies and gentlemen, there's still a long way to go and a lot of work to be done. And we can achieve very little alone. We need to work together. Academia, politics, civil society, the private sector and industry, in the rich and in the not so privileged regions of this world. Together, we can make a difference. Together, we can bring progress to the people in need. Together, we can contribute to a better and healthier world. The World Health Summit is the forum where we meet. We have an important and unique academic network, the backbone and think tank of the World Health Summit, the M8 Alliance, of academic health centers, universities, and national academies of medicine and sciences from around the world. One of them, the founding member of the M8 Alliance, is Montreal and the Université de Montréal and the Clinical Research Institute of Montreal. And therefore, please welcome with me my colleague and close friend, Hélène Boisjoly, Dean of the Faculty of Medicine of the Université de Montréal and President of the World Health Summit 2017.
Thank you. Honorable Ministers of Health of Germany and Portugal, Monsieur l'Ambassadeur du Canada, Professor Ganten, President of the World Health Summit, dear colleagues and honorable guests. Good afternoon et bienvenue at the 2017 World Health Summit. This is our 9th summit in Berlin. Since 2009, the World Health Summits have become key events addressing crucial global health issues by gathering together academia, health professionals, policymakers and members of government, partners from the industries, from the NGOs, community groups, and students. Over the years, the World Health Summit meetings have gathered people from these different backgrounds, not only here in Berlin, but 5 times already around the world to discuss regional global health issues. In Montreal, Canada, last May 2017, l'Université de Montréal et l'Institut de recherche clinique de Montréal hosted a North American Regional World Health Summit. The topic was health and healthcare delivery in pluralistic societies. Together, the M8 Alliance members, inspired by the speakers and participants, came up with a declaration covering 12 priority actions aimed at improving health and healthcare in our societies that are more and more diverse. And we had a special focus on the First Nations of Canada. The issues that will be addressed here in Berlin, such as global health security, healthy and resilient cities, and big data for health governance, are also calling for dialogue, interdisciplinarity, and international collaborative approaches. Scientists, health professionals, and managers from the industry and the civil society must work hand in hand to give our fellow citizens of the world the best world where they can thrive and be healthy. I am convinced that this collaborative message will emanate from the present 2017 World Health Summit in Berlin, and also from the next 2018 regional meeting in Coimbra, Portugal. In conclusion, our world is continuously confronted with health challenges. Together, let's continue to innovate, to collaborate, to come up with accessible health solutions for the best benefit of all. Thank you.
Now, this is not a joint chorus, but it's our great pleasure to ask the Federal Minister for Health, Hermann Gröhe, to take the floor. Thank you very much.
Professor Boisjoly, Professor Ganten, Excellencies, distinguished ladies and gentlemen, it's a great pleasure for me to welcome you here to the 2017 World Health Summit. The World Health Summit has become a fixture on the global health agenda. This is a welcome development which I have been happy to witness firsthand over the past years. Ladies and gentlemen, today, more than ever before, there is a global dimension of health policy. And more than ever before, health is being influenced by the process of globalization. Today, we are truly living in an interconnected world. The large number of flights connecting megacities such as New Delhi or London can move germs and bacteria in just as easily as people and goods. Globalization also contributes to the adaptation of similar lifestyles and consumption habits throughout the world. They, in turn, promote the spread of non-communicable chronic diseases, which are no longer just a problem in industrialized countries, but increasingly present a threat in middle and low-income countries as well. So how do we position ourselves in the face of the major impact of globalization on health? Should we primarily focus on ourselves while denying the interconnectedness of today's societies? Germany's approach has been quite the opposite. Our commitment is based on our conviction it is today that we have to set the course for the world to be better prepared in the future to cope with global health challenges. But we will only succeed if we act together and assume responsibility jointly. Germany is therefore a true believer in multilateral solutions to global challenges. This is why Germany is committed to its international responsibility in health. Our commitment is guided by 3 principles. First, we are convinced that only by acting globally we will be able to ensure comprehensive health protection locally. Second, we wish to fulfill our global responsibility and contribute towards securing the right to health for populations worldwide. Third, the United Nations in general and the World Health Organization in particular have a key role to play in coping with global health challenges. Therefore, we advocate for strengthening the international health institution, in particular WHO. Germany wants to play a constructive role in advancing global health. During our G7 and G20 presidency and through the personal commitment of our Chancellor Angela Merkel, Germany has put global health on the highest political agenda. Overall, Germany has stepped up its support for global health to more than 850 million euros per year. This also includes a clear rise in contributions to the Global Fund to fight AIDS, tuberculosis and malaria, and the Global Alliance for Vaccines and Immunizations. Ladies and gentlemen, a key milestone of Germany's commitment to global health is our G20 presidency that continues until the end of November. Together today for a healthy tomorrow, joint commitment for shaping global health. It was under this motto that we made global health a priority of our G20 presidency. Our aim was for the 20 leading economies to join forces in confronting the most urgent challenges of our times, which prominently include cross-border health threats. In the G20 context, this is not an easy sell. However, we choose to see this as a good opportunity to find solutions to global challenges with active input and political commitment from emerging economies. By holding the first ever G20 Health Ministers meeting, we have sent a clear political message. Joint commitment and action in close cooperation with WHO are indispensable for preventing the devastating fallout from global health crisis. The same goes for stemming the tide of antimicrobial resistance that is threatening the life of millions of people and thus also affecting societies and economies. In the circle of the G20 health ministers, we ran a simulation exercise to check if we have learned the lessons from the Ebola crisis. This exercise showed that the G20 countries are aware of the need for better pandemic preparedness. They are willing to work together closely and with confidence. As a consequence, the G20 health ministers agreed to hold regular simulation exercises at national, regional, and global level. Also, we concurred that stable and resilient health systems are the best way to prevent health crises. They are the prerequisite for achieving Sustainable Development Goal number 3, ensuring healthy lives and promote well-being for all at all ages by 2030. In the group of 20, moreover, we also agreed to combat AMR and to pool our resources to prevent a post-antibiotic era. An integral part of that effort is the so-called One Health approach. I'm glad to say that 1 month ago we already successfully held a follow-up to the G20 Health Ministers meeting in this regard, the first combined meeting of the G20 Public Health and Veterinary Public Health Institutes. In spite of the threat posed by globally soaring rates of AMR, next to no new antibiotics classes have come on the market in the last decades. Therefore, the fact that the G20 committed to stimulating the research and development of new antibiotics was an important success. We cannot do without effective antibiotics. It is as simple as that. Together with other international partners, therefore, we raised 56.5 million euros so far for the research and development of new antibiotics. We pledged this funding, the bulk of which comes from Germany, to the Global Antibiotic Research and Development Partnership, GARDP, in Berlin last month. Obviously, it's in our common interest that global health remains high on the agenda of G20, also after our presidency. This is why we are very happy that Argentina has promised to take over and continue the topic of health during its G20 presidency, and as well as Italy focusing on health during its current G7 presidency. The many German initiatives of recent years proved it. Over the last few years, global health has become a key pillar, a trademark of German politics, an expression of our international responsibility. For us, global health goes far beyond the original area of health policy. Health crises and weak health systems have the potential to destroy societies, destabilize countries, or severely damage the relations between them. Therefore, we understand global health as a central element of our foreign policy. It is a determining factor of peace and security. In line with this, Germany is seeking a non-permanent seat on the United Nations Security Council for the years 2019 and 2020. We are determined to put global health on the agenda of the United Nations Security Council. In light of the above, it's beyond doubt that even after Germany's G7 and G20 presidency, we will spare no effort to advance global health on the most various levels. It is very encouraging that our international partners respond in such a positive way to the new leadership role that Germany has come to play in global health. And I would like to stress, given the current geopolitical setting, our international partners hope and expect that Germany will keep up its strong commitment to global health with a strong support for multilateral action. Options to do so exist in several fora. In view of Germany's larger role, new public health challenges and changes in geopolitics, we intend to revise the federal government's concept for global health, setting new priorities and adapting it to current trends in global health. The new strategic approach will have to be developed in the coming year, in a process involving all relevant ministries and broadly consulting non-state actors, indeed all of you, in order to guide and strategically advise the government in the important process. An international advisory board on global health has been established. It is very clear that Germany will keep up its support for finding multilateral solutions to global health challenges. As a member of the WHO Executive Board from May next year, we will use our mandate to support WHO under its new General Director Tedros and to initiate the necessary reforms. In addition, throughout the next year, we will have many opportunities to advance global health in the multilateral forum in close cooperation with WHO. We will have three most important UN high-level processes on tuberculosis, non-communicable diseases, and AMR. All three processes offer great perspective to carry forward our strong commitment as shown in the current G20 process. Germany certainly has an important role to play here. However, also the German EU Council presidency in 2020 will provide an excellent opportunity to jointly tackle global health policy challenges within the framework of a stronger European profile. Germany's understanding of politics demands that we only strive for global health in close cooperation with our partners and all relevant actors for the good of all. In our view, this also includes a close and trustful cooperation, trustful inclusion of civil society, academia, private business, and foundations. We know that all of them, all of you, contribute to global health in major and positive ways. This is what accounts for the strategic importance of fora such as the World Health Summit. The World Health Summit is a best practice example for how to integrate central actors from academia, civil society and the economy with decision makers from politics and international organizations to build a constructive and innovative dialogue. I believe that not only Germany's input to global health would benefit from having an even stronger formal network, including all relevant partners on a frequent basis. This is indeed why we are pursuing the establishment of a global health hub here in Germany to enhance cooperation for global health, and we invite all of you to join us in this endeavor. From our point of view, the vivid exchange with civil society, academia, and the private sector is a key principle of good governance, as global health policy needs to be built on the real needs of the stakeholder groups involved. This is the sense, in this sense, the World Health Summit is a beacon shining far beyond Germany. I'm looking forward to joining your exchange. Thank you very much for your attention.
Thank you, Minister Gröhe, for describing the global health commitment of Germany. Now, please welcome Professor and Dr. Adalberto Campos Fernandes, Minister of Health from Portugal.
Dear President, Professor Detlev Ganten, dear colleague Minister Hermann Gröhe, Excellencies, dear colleagues, ladies and gentlemen. It's a great honor as a member of the Portuguese government to participate as a speaker in this World Health Summit, being a member of such an alliance of academic health centers, universities and national academies. This well-known collaborative network of academic institutions works tirelessly from 2009 to the present day to achieve its main end goal, to improve the health conditions on the world population. We all share a common view on integrated research and clinical practice into healthcare services worldwide. We also share a common view on promoting education and knowledge. The Portuguese government stands strongly for modern, safe and qualified public services as healthcare, combating inequalities and promoting social cohesion. Standing on knowledge, healthcare professionals will promote health with a new confidence and perspective. Standing on new information, people will change their attitude, being more preventive and aware of the risks of disease. I sincerely congratulate our host, the Minister of Health, the organization of the World Health Summit, its President, Professor Detlev Ganten, and his team for the warm welcome and challenging work of these days. Also, I congratulate all countries, institutions present in this hall for participating, showing initiative and due diligence. We are all part of a movement and we share an ambition. Portugal has evolved rapidly. It's beginning its way to be considered as a standout country in the digital evolution chart, highly digitally, advanced and exhibiting high momentum. We deem as most relevant the presence of Portugal in this important international and high-level network of academic and clinical centers. M8 Alliance opens for us a wide range of possibilities for future projects with our partners. We keep in mind the declaration of the United Nations Millennium Development Goals and the more recent Sustainable Development Goals. The new agenda calls on countries to begin efforts to achieve 17 Sustainable Development Goals over the next 15 years. Portugal is also a country known by its National Health Service, considered one of the best of the world. Recent statistics of the WHO place it at #1 in childhood health and in general at top 10. Where many of the health professionals of these African countries study and obtain their professional knowledge in Portugal, which give us a special bond. Finally, I would say that the strength of M8 Alliance results from all its different members' capacities and knowledge, and so we strongly believe that it's also necessary and urgent to focus on health education systems to make the necessary changes to develop a common global health curriculum. The Portuguese government and I, myself as a Minister of Health, wish all the participants on this World Health Summit a profitable work during the next days, and hope we'll find all of you in Coimbra next April 2018. Thank you very much.
Thank you so much, Minister Campos Fernandes, for the support of our activities, but also especially for the Coimbra University to organize the regional meeting of the WHS Summit. And I know personally this is not lip service, this is very active support, which we need, which we all need, political support for what we are doing. Talking about togetherness and global health, there's one institution which is in our mind, and that, of course, is the World Health Organization. We are very closely collaborating with WHO, and they're always present, and the former Director General, Margaret Chan, was here at the World Trade Summit. Dr. Tedros, the new Director General, wanted to come and wanted to be present and provide his message, but he just got in office. There's so much to do that he said, please accept a video message. So please, ladies and gentlemen, listen to the video message of Director General Dr. Tedros.
Excellencies, my brother Minister Gröhe, President Hélène Boisjoly, and President Detlev Ganten, distinguished guests, ladies and gentlemen, Guten Morgen. I'm sorry that I cannot be with you in person. The World Health Summit has become an important forum for advancing global health. I was proud to be involved in the first World Health Summit in 2009 as Health Minister of Ethiopia and Chair of the Global Fund Board. And I am pleased to see how this meeting has grown. As Germany increases its political and financial commitment to global health, I would particularly like to acknowledge Chancellor Merkel for the leadership she has shown in advancing the twin priorities of universal health coverage and global health security. I was honored to be invited by Chancellor Merkel to address the G20 meeting in Hamburg earlier this year. My message was that viruses don't need visas, pathogens don't need passports. And although we don't know which bug will spark the next pandemic or where it will start, we do know how to prepare for it. Outbreaks are inevitable, but epidemics are preventable. By investing in health systems that provide people with the health services they need, when and where they need them, without exposing them to financial hardships. And of course, access to health services means little unless it's safe and high quality. This is the essence of universal health coverage. Far from being a luxury that only rich countries can afford, evidence and experience both show that universal health coverage is within reach for all countries at all income levels. In short, it's a political choice and the best investment for a safer, fairer, and healthier world. I wish you a successful meeting and look forward to being with you next year. I thank you.
So we all say good afternoon to the WHO Director General Tedros. It's now a special pleasure for me to introduce Dr. Joanne Liu. She is a professor at Université de Montréal on leave of absence, but for something for action so important. So please welcome the president of Médecins Sans Frontières, Doctors Without Borders, Joanne Liu.
Merci, Dr. Boisjoly. Distinguished guests, ladies and gentlemen, thank you for inviting me here. Just a few days ago, I returned from the Rohingya refugee camps in Bangladesh. Since August 25th, hundreds of thousands of people have poured across the border from Myanmar. A wave of desperate humanity. While Europe is bragging about its successful migrant deterrence policies, Bangladesh has bravely welcomed a total of almost 1 million Rohingyas over the years. Their stories are chilling. In the chaos of the exodus, they suffer unspeakable mental and physical trauma. Families were torn apart. Sisters were separated from brothers. Mothers from fathers. Many of the women were raped. Many of the men have disappeared. Elders who did not manage to flee were burnt alive in the torch villages. Now, they are packed, lost and disoriented, into a mega camp, Cox's Bazar. They are in survival mode, still running on adrenaline, lining up knee-deep in mud just to get a piece of plastic sheeting to cover themselves, a bowl of rice to mock their starvation. In one of our clinics, every day, we register 1,000 outpatients. Adult patients collapsing of dehydration. For almost 1 million people, there are only 210 hospital beds. Many patients are sharing their bed. The hospital floors are covered with mattresses. The influx of refugees is straining the local Bangladeshi infrastructure. Believe me, the situation holds no joy. There will be no easy solution for these people. They need our long-term commitment and our help. This camp is a time bomb, a looming medical humanitarian catastrophe, unless massive aid is scaled up for shelter, water and sanitation, food, and healthcare. It is an irony that as we sit here talking about global aid, those people sit in the mud. Sterile conversation that might amount to nothing. How does this translate to an extra bowl of rice or a child being vaccinated? The Rohingya in Bangladesh are on the brink of a public health emergency. If global health is to fulfill its goal, it cannot leave them out. Today, global health responses are triggered by threats rather than medical needs. Global health is now rebranded as global health security. Against the backdrop of war against terrorism, aid is only given if wealthy nations feel threatened by a crisis. Otherwise, the crisis is a non-event. This mindset dictates selective humanitarianism, a humanitarianism where national security interests outweigh medical needs. As long as we view crisis through the lens of security, people's health will be sidelined. It was selective humanitarianism that dictated the Ebola response. For Ebola, a sense of deep urgency surfaced when affected people started being flown back to the US and Europe. An earlier global response could have prevented much. More than 28,000 people were infected and over 1,000 died. 11,000 died. Reacting to an epidemic only when it's knocking at one's door means thousands of people have already died. While governments here might see their success because they kept Ebola out, West Africa saw the lost lives. When security interests predominate, health takes a hit. Yemen is the poster child. There, the security agenda has now seized healthcare as a pawn of its game. Bombing hospitals and other infrastructures is now considered a smart tactic. That tactic has wiped out 60% of the country's health facilities. Gone too is their water and sanitation and their electricity. It was a perfect recipe for cholera, which is now raging in an epidemic of unprecedented proportion. Almost 800,000 cases. The most massive outbreak in modern history. Still thriving because the healthcare system has collapsed. And elsewhere, from Yemen to Syria, from Nigeria to South Sudan, health facilities are looted, burned, and bombed. We live in a times where a child can be killed in a mother's arm in a medical facility. We live in a times where hospitals are places of fear instead of healing. We live in times where health workers are abducted, assaulted, and killed. In many war zones, patients, medical staff, and hospitals are being crushed by the anti-terror agenda, bulldozed by a narrative that increasingly paints all opponents as terrorists. Last month, I visited Libya, where thousands of migrants fleeing conflict, famine, persecution, or poverty are being starved, abused, and tortured. Their sole sin is wanting a better life, a future. They are just following a basic survival instinct to feed their family, to protect their children, to find a better life. Nothing beats a parent's motivation for a child. Europe's closed borders have trapped them in a business of exploitation and despair. I am still haunted by the story of a pregnant mother I saw there, forced to stand on one leg under the burning sun until she fainted. She whispered to me, "My heart flew away." And then she confided that pregnant women were singled out for sexual abuse in one of the places where she was held. As long as the push factor doesn't change, brutal war, hunger, rampant poverty, and abusive regimes, people will continue to flee. Yet, the barriers are always there. Borders are closed, walls are built, people have no other safe option. By pouring money into containing them in Libya, the European governments are perpetuating their abuse. As a humanitarian medical organization, we see a reality where millions of people exist in displacement, disease, and in danger. If the goal of the World Health Summit is to improve global health, you must address their needs too. It means stepping back from the security at all costs that abstract their needs. It means not putting your sense of security over their health and their lives. It means carving out a safe place for them, a space of humanity. Thank you.
Well, what tremendous challenges, what a wonderful organization, and what a courageous lady. Ladies and gentlemen, it's a great pleasure to introduce the next speaker, Werner Baumann, the CEO of the Bayer company. For quite some time, Werner Baumann has been among the masterminds for shaping this company along its mission, Science for a Better Life, a life science company with a rather unique profile: pharmaceuticals, consumer health, animal health, crop science. But Bayer also has a long history and a long tradition of taking responsibility for global health issues around the globe, with Access Accelerated or One Health being among the most recent examples. And this is why we feel really privileged to have Werner Baumann as our guest tonight. Please welcome him for his presentation.
Thank you, Professor Wiesler, for your nice introduction. Dear Ministers Gröhe and Campos Fernandes, dear Dr. Liu, dear Professors Boisjoly and Ganten, ladies and gentlemen. It's a real pleasure and also a privilege to speak to you as part of this year's opening ceremony of the World Health Summit. And quite frankly, what a great occasion to engage and talk about how we can jointly tackle some of the most fundamental challenges of our time. I would actually like to take the opportunity, following also the remarks of Minister Gröhe, to talk about what a company like Bayer can do to help contributing to the One Health concept. I would also like to talk about the right framework for innovation and a framework that needs to be based on scientific facts and decisions. Let me now start by saying that scientific facts are not all the opposite of feelings and emotions, but they are very often the precondition. I want to give you a little example of that. It is the example of a 5-year-old boy named Teddy. Teddy wrote a letter to his doctor, and I have it here with me, where Teddy says, "Dear Dr. Banting, I wish you could come and see me. I'm a fat boy now, and I feel fine. I can climb a tree. Lots of love from Teddy Ryder." So why is Teddy such a happy fat boy? Because he was treated with a therapy that tremendously changed his life. A few weeks before, he only weighed 25 pounds at the age of 5. All of this happened 100 years ago. Teddy was one of the first 12 patients that were treated with insulin. Before this breakthrough innovation in the early 20s, diabetes could not be treated at all and soon led to death. After this innovation, patients like Teddy could be helped, and after the first therapy, he lived a normal life without significant diabetes-related complications. So this innovation was only possible because Dr. Banting expected what we know today, that animals and humans suffer from many of the same diseases, such as diabetes. He was able to extract insulin from the pancreas of a dog, and he detected the blood sugar lowering effect of insulin in another dog that suffered from diabetes. So this knowledge of animals and humans led to the Nobel Prize in Medicines in 1923, and much more importantly, it saved the life of Teddy Ryder and so many thousands of others since. It is one of these stories that tell us as a science-based company and organization why we exist and how we can make a difference in people's lives. Today, we know more about commonalities and the interactions between animals and humans, but also about the various influences and interactions of plants and the environment at large. Over the years, scientists began to gain a better understanding of the characteristics of living species and the disease transition routes. We know that nearly 75% of emerging human infectious diseases in the past 3 decades originated in animals caused by contamination, pollution, and degradation of air, water, and land. For example, the clearing of tropical forests can create breeding grounds for several types of mosquitoes that carry malaria, Zika, as we know, dengue, and many other diseases. You can really say everything is connected. It is the puzzle of life with a multitude of pieces that possibly are affecting each other. And it shows that we are not living in an isolated world with the health of each species, but in a world of just one health. So the questions are, what can a company like ours do about it? What is our answer? How can we address One Health as a company and contribute? So let's take a look at some of the major challenges of our time that the United Nations recognize as Sustainable Development Goals. BIO strongly supports good health and well-being, and zero hunger as 2 of these major developmental goals. Today, we contribute with innovative solutions for more safe, high quality, and also affordable food in a sustainable way. And we also provide solutions for our aging society, well-researched drugs for serious diseases, as well as products for the growing trend to self-care. This is why we as a company have consciously developed ourselves in the last years to a life sciences company that for purpose and strategic ambition is clearly connected with the development goals of the United Nations. And with the planned acquisition of Monsanto, we are taking just another step in the journey to biology, as one analyst recently wrote. With the changes of our organization, we are developing a new mindset of collaboration by, for example, better understanding diseases across species or sharing technologies across our divisions. We have developed platform technologies with which our scientists are working on different topics, or we use the same tools for exploration. I'm sure some of you followed the announcement of this year's Nobel Prize laureates in the last weeks. The Nobel Prize in Chemistry was awarded to the so-called cryo-electron microscopy, which significantly improves the imaging of biomolecules. At Bayer, we are working on applications of the cryo-electron microscopy. It's getting better. I'm doing this 10 more times and then it works. So to amplify stuff. So in the process of both drug discovery in pharmaceuticals and in crop protection as well. At the same time, very importantly actually, our divisions continue to focus on their specific targets and objectives. In selected therapies, for example, cardiovascular, we are a leading company that delivers superior value for patients worldwide. So this shows, while we subscribe to One Health as a concept and while we build up the tools for more collaboration, I really am totally convinced that we are only scratching the surface today, and there's not enough of a base as of yet for a single company like ours to build a strategy on it, but we are firmly committed to One Health and taking it to the next step with what we can support it on. In every division, we do look outside of the box and strive for holistic solutions. And as a leader in agricultural industry, Bayer has great responsibility to consumers, not only to provide products to farmers, but to encourage healthier food choices. As a partner in the fight against tropical diseases, we want to contribute by both providing medicines to treat patients, as well as offering solutions to control vectors. Unmet need continues to be huge in human health and nutrition. Just to keep in mind, our climate is changing with huge challenges, especially for farmers all over the world. The human species is changing dramatically as well. We are living longer and longer, and we will be more and more people as population grows across the world. Both lead to fundamental challenges in the fields of both health and nutrition. We are fully committed, convinced, and also well positioned, I believe, to help address these challenges and the opportunities of One Health. But we also know that actually nobody can go it alone. Collaboration is the key because these questions are way too big. That's why we tackle a lot of these challenges together with partners. Just let me give you some quick, but I think fairly impressive examples. It is estimated that about 10,000 diseases are caused by a specific gene defect. The CRISPR-Cas9 technology has the potential to cure many of them. And as a part of our Bayer Life Sciences Center, we have founded a joint venture to discover the possibilities of gene editing for some of these diseases to be cured. But with the same technology, it is already possible and also possible to work in crops and, for example, enable them to better withstand climatic stress or water scarcity. Gene editing is a good example for breakthrough innovation with translational effects on different species where you need different scientists and expertise working together. This is also true for another joint venture of the Bayer Life Sciences Center. We just co-founded a few months ago a company to develop the beneficial microbes for plants that could significantly reduce nitrogen fertilizer. Just think about the potential benefits to the environment if we were to need significantly less fertilizer and subsequently reduce nitrate levels in soil or water, for example. Everything hangs together with everything. So this could be a huge contribution for sustainability, which is of paramount importance in the times we live. But as you know, also human organisms host countless microbes, and at the World Economic Forum, the human microbiome was even named as one of the top 10 emerging technologies just about 3 years ago. So this is another example of fascinating research that possibly could also affect different species in some time to come. With these short examples, you could see what a better and more holistic understanding of interdependencies could lead into during the next maybe 15 to 20 years. And just imagine the many letters similar to the one I just showed you, we could see. For all of this to happen, we also need acceptance for technology and science. We need proper and fact-based regulation as well as appropriate incentive systems or elsewhere funding mechanisms. We must see the bigger picture, for example, that chemical crop protection can lead to less soil erosion and at the same time reduce the need for irrigation. or that innovative medicines can help to prevent diseases and expensive therapies for people that need to be hospitalized. We need political and also regulatory decisions that are based on facts and not on feelings or political positions. That's basic requirement for everything, but unfortunately, these days, this is not self-evident. I think that in our area of transparency, we as a science-based company and communities really have to engage in order to build trust. It's not enough to explore the word. We also need to explain the word and the value of science for society. And just because answers are very oftentimes very complicated, having no answer is not an option. We have to make clear again and again that scientific facts matter and not science fiction. This is maybe the most important requirement for innovations and a fundamental prerequisite to really make a difference in people's life. Thank you so much for your attention.
Thank you, Mr. Baumann, for this wonderful illustration on how science drives progress and that, of course, products are needed to bring this progress to the people. And for this, we need the private industry. So collaboration here is of the utmost important. And the example of One Health as a holistic approach to scientific progress and making use of it with various types of products in the whole area of fields from plant biology to medicine, I think is a wonderful example to consider for future developments. Now, in the forefront, ladies and gentlemen, of science, of course, are many people who deserve the Nobel Prize. Not everybody can get the Nobel Prize, but one of those who really deserved it and got it was my good friend and colleague, Roger Kornberg. And thank you very much for coming long way from Stanford to give us your view on the progress of science and what that contributes to global health. Thank you very much, Roger.
Detlev, thank you very, very much for this kind introduction. Distinguished colleagues, ladies and gentlemen, it is a privilege to speak on this occasion and to offer an academic perspective on the future of medicine and of world health. And what I have to say actually follows logically from the wonderful talk of the previous speaker. It begins with what you know. You're all aware of the wonders of modern medicine, but what not everybody knows is modern medicine, and in particular medical science, is little over 100 years old. Not much more than a century ago, disease was attributed to an imbalance of humors, and the only treatments were bleeding and violent purgatives. Medical schools a little over 100 years ago were trade shops that were funded by fees from students who gained licenses to inflict their ignorance on the population. Change began in Europe in the latter part of the 19th century, as many of you know, with the germ theory of disease and the work of Pasteur, Koch, Ehrlich, and others. Charles Eliot, who was president of Harvard at the time, was aware of these developments and also of the appalling state of American medical science and American medical education. He proposed to introduce in the curriculum at Harvard Medical School medical scientific subjects. The most powerful member of the Harvard medical faculty at the time, a noted surgeon, said, Eliot actually proposes to have written examinations for the degree of Doctor of Medicine. I had to tell him that more than half of our students cannot read or write. No medical school has thought it proper to risk large existing classes and large receipts by introducing rigorous standards. Now, what followed in the 20th century, from roots in science, from exploration in all fields from physics to biology, is, of course, the marvel of medicine today. And if I were to ask members of this audience what were the most important advances in medicine in the 20th century, most would make a similar list. X-rays for diagnosis and treatment, the discovery of antibiotics, which have, of course, largely eradicated bacterial disease. Cell culture, which led to the polio vaccine. Non-invasive medical imaging, such as MRI, for early detection of cancer. Genetic engineering, which is the basis of a large number of new medicines, and so on. These medical advances all have one thing in common. All were discoveries made in the pursuit of knowledge for its own sake, with no idea of any application, no purpose in the prevention or cure of disease. So the lesson of the past is counterintuitive. To solve a really difficult problem in medicine, don't study it directly, but pursue a curiosity about nature, and the solution will eventually emerge. Do basic research. Now, the success of medical science in the past century has become, in a way, its undoing. We are all dazzled by the knowledge we've acquired, and we rush to apply it to medical problems. This is understandable, but it is sometimes premature. Take, for example, the human genome, the font of all medical knowledge. It's all there, the answer to every question about human biology. The trouble is the answers are written in a language we don't understand. At present, we can only dimly perceive the significance of the genome. I could convince you we can grasp less than 1% of medical knowledge. Just imagine if the medicine of today flows from 1% of medical knowledge, how much more would be possible if we knew the remaining 99%? Now, just to continue with the genome in particular, our knowledge in this case is limited to the order of letters in the genome, the so-called genome sequence. And this bit of knowledge has delivered great benefit to human health. For example, non-invasive prenatal diagnosis, or NIPD, for the detection of genetic defects. Liquid biopsy for early detection of cancer. The prospect of gene therapy that was mentioned a moment ago, and much more. But these great successes of translational medicine are just the bare beginning. We know the order of letters in the genome, but we can't read the words. As I have indicated, we don't know the meaning. And obviously most, as I've said, 99% or more of knowledge resides in the meaning. And when we know the meaning of the genome sequence, we will know the cause and the cure of everything, from disease to aberrant behavior to aging. What more persuasive call to the pursuit of basic medical research can there be? Now, as I have indicated, this call is often unheeded, and traveling around the world, I'm often disappointed by a shift of resources from research to application. Now, I'm myself very much involved in application, and I think it's of utmost importance, but application at the expense of research is sheer folly. And it's ironic, just as the lesson of the past century is learned, it's forgotten. Now, this is not only a scientific, but a political problem. The support of basic research has traditionally come from government rather than from the private sector, and for good reason. The timeline is very long. Basic problems take decades to solve. Only the public, with a lifelong interest, will support such an undertaking. Industry, with a short-term interest, an eye on the bottom line, can hardly be expected to do so. I mean, what CEO could report to his or her board that a major investment has been made in research that may or may not become profitable in 20 years or longer? To give you a specific example, a leading oncologist at the Memorial Sloan Kettering told me about a pharmaceutical company developing an anti-cancer therapy, forced to choose between a potential cure and a drug that must be administered weekly for the life of the patient. And he said management made absolutely the right decision on behalf of shareholders and pursued the less effective drug. He told me this is not a rare occurrence. Government clearly has a special responsibility and a unique role to play. Now, governments have performed this role very well in the past. Some 50 years ago, actually closer to 60 years ago, the US government, and soon after those in Western Europe, began funding basic biomedical research. And that investment has been repaid many times over. How many people do you think were crippled or died of polio in the US or Europe last year? The answer is probably zero. And that's due, of course, to the polio vaccine. Imagine the savings in treatment and productivity, not to mention human suffering. Not only has the investment in medical research been repaid, but it was very small to begin with. The annual budget for cancer research in the United States today is $5 billion, less than 10% of the annual expenditure on soft drinks. And yet, despite the small size of that budget, it is repeatedly cut by the US Congress. At a time when medical science is poised for the ultimate payoff, the cure of cancer and other dread diseases, many promising leads cannot be pursued, they are abandoned. Finally, you may ask, what does all of this have to do with the World Health Summit? And my answer is to the next generation, to the young doctors and medical professionals who will continue what my own generation has pursued, in many cases begun. Let your practice of medicine be not only compassionate, but also productive of new knowledge. Do basic research, advocate for basic research. Yours is the legacy of 100 years of medical science. You will be the ones to carry it forward, to instill it in others, and to realize all of our hopes and dreams for the betterment of world health and the human condition. Thank you.
Thank you so much, Nobel Kornberg, for this plea for scientist-driven research, which is so important. And we hope that governments that can continue to support, and even more support the creativity of scientists. Now, all this knowledge has to be transferred somehow to the people who most need it. Please welcome now Dr. Franz, Christoph Franz, Chair of the Board of Roche Holding Limited.
Excellencies, Ministers, ladies and gentlemen, Minister Campos Fernandes mentioned the United Nations Sustainable Development Goals for 2030. And one of them is the goal to reduce morbidity from non-communicable diseases, NCDs, such as cancer, heart disease, or diabetes, by 30%. While NCDs affect people of all ages and from all geographies, the burden is most felt in low and lower middle income countries, where 80% of deaths from NCDs occur. This is because many of these countries face significant challenges that limit disease awareness and access to diagnosis and care. I'm afraid
if we continue the path we are on right now, we will not reach this ambitious goal of reduction of 30% by 2030. Hence, practical solutions and partnerships are critical in driving meaningful progress forward in the next years to come. First, I think it is essential that we are clear about the role the healthcare industry can play. The greatest contribution to society of research-driven companies such as Roche is pushing the boundaries of science, building on the insights of basic science, as we have just learned, and coming up on this basis with novel diagnostics and novel medicines that really make a difference for patients. Let's take cancer. In my childhood, cancer was a death sentence. We've come a long way since. Now, thanks to, for example, cancer immunotherapy, for the first time, there is a justified hope that we will in the future be able to provide highly effective, life-extending treatment also to patients in the advanced stages when the cancer has metastasized. We are only in the beginning. Not all patients and not all of the types of cancer will be eradicated by this new type of medicine. But the first successes are impressive. Thanks to this new form of treatment, many patients can regain control of their disease, even their life again. For many diseases, scientists are only now learning to understand, and we have just heard, if we assume that we have only 1% of the insight of the knowledge which is hidden in the human genome, what a wealth of additional insight is lying in front of us. And this is our role in the research-based industry to develop highly specific molecules to counter the root causes of the disease instead of only trying to alleviate symptoms. When you think of new healthcare threats like antimicrobial resistance, mentioned several times, or Alzheimer's, I clearly see the research-driven industry as a critical part of the solution. Groundbreaking advances in medical science are, of course, only meaningful when they reach patients. And during my visits in our affiliates all over the world, I always seize the opportunity to talk with health authorities, visit local hospitals, and also try to meet patients. What strikes me is that for the individual patient, many diseases are not only health threats, but also financial burdens. In Southeast Asia, for example, 75% of patients diagnosed with cancer suffer financial catastrophe or death within 1 year. Meanwhile, medical insurance schemes cover less than 8% of the population in Africa. Too often, patients are turned away or go into debt because they cannot afford proper cancer care. And this is actually not only true for developing countries, but also for developed countries if patients had to pay medication out of their own pocket. In order to protect patients from financial burden, funding is needed for investment in healthcare and the reimbursement of medicines and diagnostic tests. The public sector, especially governments, has a key role and responsibility in enabling functioning healthcare systems, not necessarily paying for everything, but at least organizing mandatory functioning health insurance systems. Access to healthcare, ladies and gentlemen, is a multidimensional challenge for each society. Improving one aspect of healthcare is often not enough. For instance, access to a hospital for a cancer patient is only beneficial if there is a trained oncologist. In turn, access to a diagnostic test for a disease is only effective if accompanied by education and awareness. The barriers to this differ from country to country. That's why Roche is focusing on locally tailored solutions at the country level. I'm absolutely aware that no one can overcome the challenge alone. Public-private partnerships, I feel, are critical in the future, particularly in developing countries. Recently, I had the opportunity to travel to 3 sub-Saharan countries, Kenya, Nigeria, and Côte d'Ivoire. Roche is in Kenya, for example, working with the government and private organizations to improve cancer care. We signed several memoranda and agreements, but of course, what really counts is what is actually being implemented. So I'm pleased that last year we already installed state-of-the-art diagnostic tools for cancer detection in this country, and that new oncologists are now being trained with our support. Partnership has become more important for us as an industry, not only as a company too. Earlier this year, 23 healthcare companies have agreed to work on improving access to modern treatment for people suffering from NCDs in developing countries. For the first time, the World Bank has agreed, together with the Union for International Cancer Control, to collaborate with the pharmaceutical industry on a project like this. Our initial focus is on setting up modern cancer centers in 3 cities with population of at least 1 million people. Selected were Cali in Colombia, Yangon in Myanmar, and Asunción, the capital of Paraguay. Last but not least, I'm proud of the fact that Roche is one of the first companies to have established a differentiated pricing policy in developing regions. By aligning the prices public healthcare systems pay for our innovative medicines with the relative income of developing countries, we have significantly improved access to our therapies. In Egypt, for example, where the public healthcare system has significant budget constraints, we have created a multi-tiered pricing model with the government for our breast cancer medicines. This allows the public system to provide modern treatment to all patients in need. Another example is China, where we have significantly increased patient access for a number of our innovative medicines by creating comprehensive patient support programs and partnering with provincial governments in the country aimed at covering the majority of the treatment cost. It has been shown that we can differentiate prices based on purchasing power without products being re-imported from the low-price countries. This is important, of course, because the profits we make in the developing countries would not be enough to finance the development of innovative medicines. This solidarity between the rich and the poor countries is essential if we are to improve access for innovative products. Ladies and gentlemen, some 15 years after the decoding of the human genome, it's not 120 years, but only 15 years, we should always remind ourselves, and the adoption of the United Nations Millennium Health Goals, the opportunities and challenges in global healthcare are greater than ever. These are highly exciting times for patients in regards to the achievements made and the promise of innovation to come. Scientific and technological advances will continue to drive medical progress. And the industry has never been better equipped to develop novel solutions to meet the mounting challenges that healthcare is presenting. However, the barriers to access to healthcare for many people throughout the world are still too high. The only way to achieve enduring solutions is to adopt an integrated perspective, ensuring that locally all factors like awareness, diagnosis, healthcare capacity and funding are in place, and to engage more in international multi-stakeholder collaboration. If we pull together now, we can create a win-win-win situation. Good for patients, good for the healthcare systems, and also good for business. Roche is ready and committed to play its part. I wish you an enjoyable and fruitful conference. Thank you.
Thank you, Mr. Franz, for these examples of social responsibility and solidarity of a pharmaceutical company and your contributions to global health. Ladies and gentlemen, you may have gotten the impression by this opening ceremony that the World Health Summit is collaborating with established global health leaders. You're not completely wrong, but this is not the only group we are working with. We are also working with, and you may have seen that, with young leaders in global health. And there are many students and those who want to become leaders and learn from established leaders. And we have a program that young leaders in global health have an opportunity to speak up here completely uncontrolled. They can say whatever they want to say. All we have is a selection process of an international committee to try to find the best. And by some happy chance, the speaker of today is a young global leader from your Royal Highness, from your country, because that is a country, obviously, where education is so good that there are so many applications. And Batul Alvandali was the one selected to present her views today. Batul, may I ask you to come up front? You are sitting there in the audience, and give us your views on what could be done. Thank you so much.
Good afternoon, ladies and gentlemen. I was just introduced with a very catchy phrase, young leader in global health. Well, I'm here today to talk to you not only about myself, but also about the young leaders in global health from all around the world who are shaping the future of tomorrow and actively advocating for change. My name is Batul Al-Wahdani, a sixth-year medical student from the beautiful, peaceful country in the Middle East, the Hashemite Kingdom of Jordan. I'm proudly representing the International Federation of Medical Students Associations and collectively the voices of 1.3 million medical students from 127 countries around the globe. It all started back in 1951, when we envisioned a world in which we unite for global health, when we envisioned a world in which we are equipped with the resources and the knowledge to take on health leadership roles locally and globally. We came up with a medium, a place in which students can gather, exchange expertise, and unite for global health. One big family, which is the oldest and the largest student-run organization in the world, the IFMSA. Youth, being one of the biggest demographics on earth, are undoubtedly a positive change agent in the world. We are the backbone of the future and the leaders of both today and tomorrow. We have offered, through the various opportunities that have been afforded to us, innovative ideas that reflects the needs and the concerns of the future generations, which requires that we should be entitled to participate in the decisions that affect us. And here comes another catchy word, which we make sure to practice in our everyday life, advocacy. So how did it work with us? How did it work with medical students to advocate for change? In order to assure the biggest impact of our priorities and the biggest impact of our efforts, we have decided to focus our work on global priorities, ranging from universal health coverage, antimicrobial resistance, non-communicable diseases, meaningful youth participation, social accountability, and medical education. Not only that, we have established more than 22 specialized trainings in global health, which equip medical students with the skills that will make them ready to back up their words with actions. And not to forget about the 17 specialized programs we are running in relation to global health and global problems that we are facing nowadays, from environment and health, maternal health, and medical education systems. But most importantly, that we are present in high-level meetings, we are speaking, we are debating, and we are reflecting our opinions and our work, and most importantly, advocating for what we believe in as the future healthcare providers. And the biggest and the best example is here today. May I ask for a round of applause for the students and the young people who made it here to advocate and positively contribute to global health. If I am to leave you today with 3 important key messages on behalf of the young leaders and the global leaders in this world, is that, firstly, being a good doctor or healthcare provider does not start automatically when we are enrolled into the labor market. It starts when we implement the values of change and leadership from an earlier stage in students, in graduates, and professionals. And secondly, we are a smart investment. Youth, supporting them and enabling them in all the possible resources will not only ensure us a sustainable future, but also a better and a safer one. And lastly, and most importantly, that we do have a voice. We are actively contributing to our communities today. So look around you, support these young people, and provide them with every single opportunity to advocate for change. So there you go. This was the story of young leaders in global health from all around the world. The fighters, the advocates, the change makers who strive to leave a mark, to leave their mark in the world, to not waste a single moment without positively impacting our future. And I would like to ask you all to join us continuing this story. Thank you.
Batul, all the speeches tonight were excellent, but yours was an inspiration for all of us. Thank you so much. And my conclusion is, I'm not sure whether I'm the oldest, but I'm looking the oldest person here in the room. We have to work together, but we have to work together young and old. And of course, experience is important, but optimism is even more important. And having young people with this optimistic view to the future is what really inspires us. And thank you very much. And your organization is a great organization. We are very happy to collaborate with you. Now, since global health is a serious business, but only happy people will make people healthy, and optimistic people will give faith in the future, we invite you all for a happy reception outside this room and have your inspiration inspire you for positive talks and optimistic outlook to the future. Thank you very much for participating, and have a nice evening. Thank you so much.